Hello, my name's Dr. Alan, I'm a GP. I've made this short video to give you a bit of an idea around how GP practices and hospitals work together to look after you, because often this can be a bit confusing. So generally, if you've got a new medical problem, you come and see a GP. I would have said we managed around 90% of problems in general practice. But at times there are problems that we can't manage, and we write to the hospital or secondary care to get that support. That might be clinical knowledge to see a specialist, or it might be the tests or the medications that they have available. At that point, that part of your care, the reason that we referred you, is managed by that team. Now, if you've got other problems, new problems, we still will manage you for those things, of course. But if you've got a particular issue with that particular problem, then that team is taking responsibility for that problem for the time that you're with them before and up until when you get discharged. So if you've got any letters, often there'll be a secretary's phone number. So if you've got any queries or problems, you can use that number to get back with the team to have any further discussion that you might need. So there's a couple of reasons why this is important, both for getting good medical care, but also for the resources. So in terms of good medical care, there's a few things that may be a bit hard to that we maybe not explain really, and that's so one is around tests. So when a test result doesn't tell you a diagnosis or a plan. So often when a clinician is not sure what's going on, they get a test and they use their clinical knowledge with the test result to work out what's happening, and then their clinical specialist knowledge to work out what's going to happen next. So it's not possible for someone who's in general practice, for example, to look at the test and be able to interpret that test and tell you what that means and what needs to happen next. So it's really important that if secondary care hospitals do some kind of test, that you go back to them for the result. And another reason is around, for example, medications prescribing. So the hospital doctors may prescribe you a medication. Now, there are risks involved with that, and it'll be done thoughtfully, and they'll be expecting some kind of follow-up so they can work out whether or not you need to continue on that, or if there's any monitoring. And they know that. And just because we know you're on it doesn't mean that we can safely prescribe it. It's only when they write to us to ask us to take over prescribing of that prescription that we can do that safely. There also comes a point where that episode of care comes to an end and they discharge you, and then they give us all the information about everything they've done, all the tests, all the medications that they might have started, and then we take over that part of your care as well. But in the meantime, it's important to go back to the hospital for any of those queries. And the other reason is just practically around resources. So a hospital will get around the same amount of resources for seeing you for an appointment in the hospital as a general practice would get you for the whole year. So clearly, it's if we're trying to manage you for all your other problems, but also trying to help support you with a particular problem that secondary care is supporting you with, it means that we're so stretched that we can't really do our job properly. So that's another reason why it's really important practically. If that gives us the means that we've got the time and resources to manage you and all the other patients who aren't being looked after by secondary care. So I know it's confusing navigating the NHS, and I'm just hoping that this video might give you a bit more information, a bit more confidence, so you know where to get help from and why. Thanks.